Good morning, everybody. We're going to get started. My name's Maureen Marsella, and on behalf of the New England QIN-QIO, I welcome you to today's webinar. Thank you for your participation in the Nursing Home Quality Care Collaborative. Today's webinar is going to focus on the second page of the NHSN Checklist, NHSN Facility Set-Up. Today we will cover the 3 steps on the second page of the checklist. Next week, on September 28th, we will be holding weekly phone calls for additional information and discussion that reinforces these steps. It allows you to ask questions related to where you are in this process. One of these phone calls will focus on the additional items on page 2 of the checklist, NHSN Reporting. And it may be converted into a webinar format if we find that appropriate. Please take note of the names and the contact information that I have on the screen right now. These are your state leads. Feel free to contact them at any time. We are also here to assist you on a one-to-one basis, so don't hesitate to call us directly. Now, before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. Last week's call was recorded but I will tell you there's a little bit of echo in the background. We've changed rooms, and I hope that that's going to correct that problem. I'll provide you with the details on accessing the recording at the end of the webinar. The phone lines will be on mute for the duration of the presentation. If you have to leave the presentation, please do not put us on hold, because then we will could possibly hear some of your music. Just hang up and read that and dial back in. We will take questions at the end, and I will provide you instructions on how to unmute your lines. If you would like, you can pose questions during the presentation. You can do so in the chat box on the bottom right of your screen. Please make sure to send the questions to all participants so that we can keep up with the incoming questions. So let's begin. On the first slide here, you see all of our contact information. Here is your Bible, the NHSN Facility Enrollment and Setup Checklist. Today we're going to concentrate on page 2. I will let you know that also you can get this if you go to the link at the top of this page and download it. Again, I can't stress enough, you have to if you follow this facility setup step by step and facility enrollment, you will be quite successful in doing all of these tasks. So, facility setup, preparing your long-term care facility to report into NHSN. I'm going to tell you, as I did last week, that these are very prescriptive step-by-step slides. So basically, I am going to probably just be reading directly from the slides. So, this training is for any person planning to report infection from their long-term care facility into NHSN. Most often, it is the facility administrator for your facility. Any person working with one or more facilities to prepare them to report into NHSN can also be in the audience, like trainers, consultants working with the long-term care facility, or NHSN group users. So what are our objectives for today? Today we're going to examine the purpose of NHSN Facility Setup, remind users how to navigate within the NHSN website, describe the 2 required steps in NHSN setup process, which are mapping locations within your facility and using CDC facility location description, creating monthly reporting plans. Then we will describe how to add other staff to your facility as an NHSN user, and then we will introduce the feature of joining an NHSN group. Setup follows NHSN enrollment. If you were on the call last week, and if you've started this, I congratulate you, because once you've done the NHS agreement to participate and consent in the consensus process, NHSN will send you an email and confirm enrollment is complete, and now your facility is live within NHSN. And this is what the email will look like. So, immediately following facility activation, you can log to SAM's partner portal to access NHSN reporting using that new grid card you would have received in the mail. So don't lose that card, because you will have that card for the duration of your process using NHSN, because that is how you will get into NHSN website. So setup is required before data can be reported into the NHSN reporting website. You need to do three things. You need to add locations, add monthly reporting plans, and add users and assign the rights. What does it mean to set up my facility in NHSN? So once your facility has completed all that enrollment process and became an active NHSN facility, there are a few quick steps to complete in order to be able to report infections directly into the system. First, describe all of the units where residents are located throughout the building. That's called mapping locations. This allows you to see if infections can be clustered in one place within your facility. Second, it informs NHSN which events you are planning to track by completing the monthly reporting plan. The NHSN setup process walks you through these steps. NHSN Navigation. So what is NHSN Navigation? The next few slides show you how to access NHSN from the SAMS portal and how to navigate into the live NHSN website. If you are a user for more than one facility, then you can select the facility for which you are entering information from the NHSN landing page. So, what do I do? To enter the SAMS portal to access NHSN, you go to sams.cdc.gov, and then you will see this familiar page pop up, and you will click on the middle section of this page now because you have a live active grid card with credentials. You click on that, log in, and then you will use your SAMS grid card, your username, and your password. That will then, some tips. Let's stop right here. The Internet Explorer, and I suggest that you use that browser. I've tried to use other browsers, and it pops you out. It's just not a good browser. So Internet Explorer is the best one to use. And I suggest that what you do is you save the website as your favorite, these websites rather, as your favorites, because you will be using them monthly, most probably. First of all, the reporting one is a must. When you log into sams.cdc.gov, save that site as a favorite. Then there are the long-term care component protocol resources where you can get all the resources that NHSN has for long-term care. And then also the long-term care component training resources. That brings you directly to the training resources, not just any other things that are out there on the website. If you have time playing around in that NHSN website, really is they have tons of tools that you might be interested in. And this is how you save your favorites, add to favorites. So once you have begun the process, you get to this page and you now click on NHSN Reporting where the red arrow is. That will bring you to the NHSN landing page. On the landing page, select the facility you are planning to set up and the components into which you would like to report. All facilities that you have access to will show up in the drop-down box menu. Long-term care facilities can report into both the long-term care component for tracking infections, and this is the component that you will use while you're participating in this CDI project with CMS and the QIN-QIO. You also do have the opportunity to put healthcare personnel safety components for tracking your staff influenza. But like I said, that is not required for this task. So you can see the two arrows. You will drop down to the long-term care component, and then you will suggest long-term care facility. Your facility name will come up, and then you hit submit. That will then bring you to the long-term care facility component homepage. And I want you to look to the far left. This is the navigation bar. in light blue. The navigation bar options allow you to move from one section to another within NHSN. NHSN users may see different options on this navigation bar because you have different rights and different actions that are allowed for each person. So don't get concerned. I'm going to just tell you the highlights of what you need to get this completed for setup. So, important notes about the NHSN website. Always use the navigation bar or the NHSN button to move from page to page in NHSN. If you hit anything else, you will be exited right out of the site, and then you'll have to start all over again. And do not use the Internet Explorer web browser buttons. Again, you will be knocked right out. So, we're going to move forward with mapping our locations. Mapping locations into the long-term care facility NHSN sites. Most long-term care facilities have different physical locations where residents reside and they receive care within their building. These locations might be known as units, wards, floors, neighborhoods, pods, mods, whatever you in your individual facility name them. Each resident care location in your facility should be mapped to a CDC location code description. This provides information about the type of care the resident receives in that place. When reporting an infection, the resident care location is used to identify where the resident was in the facility at the time the event occurred. So, adding a location. Again, I want you to look over into the far left side of that screen, and this is your long-term care facility component homepage, and you're going to see the navigation bar. You're going to click on facility. The bar will then expand, and you will then click on locations. Once you've done that, it will bring you to the locations page. Now, you must make sure that you fill in anything that has a red asterisk near it because it is mandatory. So for each how do we define each location within your own title? This means that for each location, NHSN asks you to create your own location code and label, so users in the facility will recognize the care location. For your user code, you will create a code to help you easily identify the location, which is the name that the facility currently uses for this location. For example, 100 East, 200 East, West Hall, South Hall, etc. Your label. You will also create the label to help you easily identify the location. This would be any additional information you would like to add about this location. Controlled access, dementia unit. Your code and label can be the same for both. You don't have to create two separate code and label names. It can be 100 East, 100 East. And again, you are the people who determine these. You're not going to get that from NHSN. You decide what you're going to name the code and the label, and you will enter those two codes and labels in the box that's highlighted in red. Now you will move on to the CDC description. CDC location description. This is a drop-down box that provides you with CDC-defined options for describing this location. Choose the appropriate CDC location description that best describes the resident population on the unit. For a description of the CDC locations for long-term care, you can visit this site below, and that site will give you a full booklet and description of what the locations should look like. Again, you can see the CDC location drop-down provides all the possible units specific to long-term care facilities. Here is where you will choose the best description for the unit you are now mapping. So, then you're going to see below that CDC location description, status and bed size. Status will default as active. Leave this as is, because this is now an active unit you want to add. The next thing is bed size. This is optional and should include the number of beds on the unit that are set up and staffed. By that I mean, If it's set up and staffed means that you have beds and that within 24 hours you can have staff in there to take care of those patients. So don't forget to click the add button. So like I tell you all the time, once you've done the code, the label, the CDC description, the status, and the bed size, you have to click on add. If you don't, you're going to lose everything you just did. And then what will come up is a location table, and it will show, as you can see below, this is what it will look like. Now you're going to, you will go back and continue to do this with all the units that you intend on putting into NHSN. The next two slides will talk about CDC location codes and description, which we discussed earlier. But it gives you more definition on what that is. And the description from CDC on what resident location codes look like. The list with the descriptions can be found at the NHSN location chapter under the long-term care facility section, beginning on page 28. And here's the link again for you to go to if you want to download that that whole guide. And here's what it would look like. Basically, it's a hospice unit, and then the second column and third column, NHSN assigns those. You will use the location description to determine what your unit is. So a dementia unit, which is right in the middle. It's a unit or a designated area which provides specialized care for individuals diagnosed with either dementia or related conditions, including Alzheimer's. So if that fits your resident, then that is the location description you would use for, let's say it was 100 East. And this is short-term, and you have, skilled nursing, short-term rehab, general nursing, ventilator, dependent, and bariatric. So, additional tips on selecting the CDC location. Resident mix. To map the appropriate location units for the location codes for the unit, review the resident mix in that unit during the previous year, and choose the location code that best describes the type of residence care service delivered on that unit. NHSN has this 80% rule, and sometimes more than one type of resident receives care in a location. For example, both long stay and skilled resident beds are sometimes mixed together. In that situation, select the location code that best reflects the majority of residents usually cared for on that unit. Ideally, the code would apply to 80% of the residents on the unit. So that means if you have 20 patients, if 80% of them are skilled patients, then that would be what you should use. But if there's not a clear majority, select the code that makes sense to you in your facility. And we're going to go over this again. You go to the NHSN Navigation bar. You select facility. That opens up. You select locations. You choose the code and the label. You create these yourself. Codes and labels can be the same. It's not a big deal. Your code and label is in there to help you easily identify your location. The CDC location selection, you select that by the drop-down grid. The status will default automatically to active and leave it as active. Bed size is optional and includes the number of beds on the unit that are set up and staffed. Then you click Add. I'm going to stop just for a minute to make sure everybody has that.
I have one question.
You have one question?
The question is, what if I did not receive a card?
It's the grid card. All I can say is that I hope you applied for the grid card and did all of that. If you've done all of that, then I think you have to email sams.cdc.gov and tell them that you did not receive your card yet.
Okay, that again?
It's Sam's. Let me see. I'll back up and tell you about the grid. I think it's Sam's. You got it right there?
Sam's help at cdc.gov.
Because if you've done everything already, then you, has it been the two things? Has it been 2 to 3 weeks? Because that's what they're telling us the process has been taking. once they receive all of your paperwork. They're telling us that it takes a good 3, and maybe it could go as far as 4 weeks right now because it's getting closer to the deadline where people have to be already enrolled in NHSN with a SAMS card. So I would say if you haven't gone to 3 weeks yet, don't panic yet. And then just send a request to them. I hope that answers the question. Is there anything is that it? Okay. We're going to open up the lines again at the end of this, so just rest assured we will try to answer every question. Let's move on to the monthly reporting plan. So the second process that you have to now do to get yourself all ready for NHSN reporting is create these monthly reporting plans. So what is a monthly reporting plan? The monthly reporting plan tells NHSN which modules and events your facility will be tracking for the month. You must submit a monthly reporting plan for each month you want to perform surveillance in NHSN. I'm going to tell you that it says here if you're not performing surveillance, then you check off no long-term care facility component module followed this month on the monthly reporting plan. That is not what the expectation in this task is. The expectation is that from October 2016, moving forward till the end of this contract, you will be submitting monthly data into NHSN for your CVI. Your plan, you can, the good thing for this is you can set a whole year up right now and submit that monthly reporting plan for the whole year right in advance, and I'm going to show you how to do that. So, monthly reporting plan options. Again, we discussed that. You are concerned only with the number 1 on this screen. You choose specific plans, which include selecting from the following options. For those participating in this CDI project, you're going to skip to number 2 box, which is Lab ID Event Module. And that's where you're going to start to enter your data. So again, you're doing that because each month indicates in which surveillance module and event your facility will report. And again, for this project, it's Lab ID, C. difficile. So on the NHSN Navigation box, you go to Reporting Plans. That will expand, and you click on Add. You select the month and year of surveillance. You complete the report, and then step 3 is to complete the reporting part. You will do section number B here. Select the organism from the drop-down box for Lab ID, and this is what it's going to look like. We go over to our navigation light blue bar to the left. You click on Reporting Plan. It expands. You click on Add. You do have the option to find, and I'll tell you what that means later. So you add. So to create a new monthly reporting plan, you click Add to the expanded box again. So selecting the month and the year. So now this brings you to the Add Monthly Reporting Plan screen, and anything that is with a red asterisk is required. So you have to choose the month and the year for which your facility will be doing surveillance. So to start the project, you're going to put in October 2016. Then you're going to move down. You're not going to do the HAI module, I'm going to skip over this. You're going to move down to the Lab ID Event module. And you're going to, this facility is doing Lab ID Event Surveillance. Then you're going to pick the specific organism type, and you're going to drop down to the very last one, which is facility-wide inpatient, which they're going to get used to this term, fact-wide in, and you're going to CDI, C. difficile, and you will check off that box in the right-hand corner. Your facility, and this is then what your facility will be at, and you only have to do that one organism. And then again, if you were going to do hand hygiene and the gloves, you would do this. Now, you're going to go to the bottom of the screen and you're going to click Save. And then you're going to get that cute little box with the green check in it that says Plan Saved Successfully. And now you have done it. You have now created your plan for October. But remember, I told you you can do this for a whole year. So what you're going to do is, well, I'll go over this anyway, as an example. This particular facility wanted to submit February 2015 data for urinary tract infection, lab ID, and process lab ID for C. difficile and MRSA, and prevention process measures for hand hygiene, gloves, and gowns for all the units. So as you can see, they clicked off February in their box, February 2015. They did the drop-down in the HAI module for fact-wide inpatient, and then in their lab ID, they did fact-wide inpatient, and they want to collect organisms, CDI, and MRSA, and then MRSA. And then they also want to do their hand hygiene and their gloves, and they hit Save, and that's what their screen on their monthly reporting plan would look like for February 2015. So, to modify a plan, you can always go in, hit Find, and then Edit. But right now, I don't think you really have. Actually, you can go in by doing that. Then this is how you will do the continuation. So you go in, you go back to reporting plan, Find. It drops down the January one, and you see the January report. So what you would do is when you go down to the middle of the screen, the Lab ID Events module, you can see circled in that copy from previous month. So you can set up a monthly reporting plan. You may copy the same selection for future months as you move forward. And you can do that for up to 12 months.
Can I interrupt for one moment?
Yep.
So we had a question. Someone wanted to clarify that for the nursing homes, they're only tracking C. diff, not MRSA or UTI.
So this project, that's all that is all that they are tracking. Now, I don't know what any other states are doing. There could be Massachusetts, and we'll get to that also, the Massachusetts Department of Health is asking them to confer rights, which we will be getting to. So I don't know if in other projects they're asking for this. But for our project right now, all we're doing is CDI.
Thank you.
So, monthly reporting plan options. As I told you, you really don't have this option of no long-term care facility component modules followed this month, because the expectation for this project is that you will submit monthly data into this NHSN website for months going on from October 2016 straight through the completion of the project, which is August 2019. So, NHSN users. This is another component that the facility manager can do for you, and that's to add users and assign rights. So, users, what are they? The NHSN Facility Administrator can add additional users to access NHSN. Additional users are always optional, but it is strongly recommended that you have at least one additional user in your facility. This is because someone can take ill, someone might have to go on an extended vacation, someone could get married and be gone for a month. You never know what can happen, or someone could leave the facility, and you don't want to be left out there having to go through the whole entire process all over again because you have no access into your NHSN database. Because, unfortunately, we can't, as the QIO, enter any data for you. That all has to be done on your end. So your participation is, you have a responsibility, so I would suggest that you have more than one user as a user in NHSN. It is the facility administrator who assigns rights to each of the users. That facilitator can add, edit, and delete any NHSN data for the facility as well as adding the users, and etc. So once a new user is added, an email is automatically sent to their email address with instructions. Each user must register for access to SAMS and submit identity proofing documentation like all of you have done within the last few weeks or are in the process of doing. That process, you get your SAMS card, that's your SAMS card for life. Each user must complete required training before using NHSN. So remember page 1 of this NHSN enrollment form. That is, I would say that you should give them the Bible, as I call it, and let them go through the list, because knowing doing those specific step-by-step things do get them more acquainted with NHSN. So how does my facility add a user or assign rights? The first step is that from the NHSN Navigation bar, select Users. That opens up, and then you select Add. Once that opens up, you come to the Enter User Information. You create a username. The email address entered must be the same one used to request their SAMS card invitation. So make sure you do use, I don't know what to do. I know some nursing homes have a shared email address. I don't know what to tell you. This is the email that everything will be used with SAMS for the invitation and et cetera. Complete all required fields. Anything that is marked with that little red asterisk you have to complete. Then, as always, click the Save button, because if you don't in NHSN, again, you lose everything to create the user. Then what will come up is the third step, which is to assign the rights by checking off the boxes under the long-term care section. And then again, for that, you will click Save to save that data. And this is what it looks like. You go over to Users, click on Users, User expands, click on Add, and then you start to add the person. User ID, that's his user, create a user ID for the new user, and then you fill in the mandatory boxes here about their name and all of that, and then they will then get the invitation. Another stress, again, same email for SAMS registration, and then hit Save. And again, you must always hit Save button when you're finished entering all of the user information, or you lose that information you just all typed in. Step 3. The Edit User Rights page will come up. As you can see, the little green check in the box that you have now successfully entered someone as a user, but now you have to give them rights. And the rights are in the far left: administrator, all rights, analyze data, edit, because there may be someone, like you may do everything in a paper tool and have your secretary enter data, and so she could just do just all the rights or analyze the data. You may have an analyst within your facility that can just look at data and not at any submission of data. So you decide what's the best thing for you, and then please make sure you click Save. So, to deactivate. Now, this is an important thing, because when a person has a SAMS card, they will have access to any of the areas that someone has given them access to. So it is necessary for your NHSN administrator for your facility to deactivate persons, that staff members that leave, so that they do not still have access to your data. So you go into that same user button in the navigation bar, click on Find, and at that point, it brings up the page, and you type in the person's, if you know their user ID, if you remember what it was, or you can just type in their whole name and click Find, and it will bring you to, at the bottom, you can see the user list. And it looks as though John Brown has left the facility. He was the director of nurses, and now the administrator now wants to deactivate him. You can see up in this grid that at step 3, you select user and click the deactivation button, and then hit the Save Add, and that will then eliminate that person from your user list. So now setup is complete. You are now ready to begin your reporting. You've, number 1, mapped all of your long-term care facility locations that you want to report on. You've created monthly reporting plans for every month going forward for a full year, and you've added those users and assigned the rights that you want within your facility. The next step for you is to begin reporting. Now, we're not going to talk about reporting just yet, simply because, A, you don't have the data because we have to finish October to have all that data, and B, I don't know if everyone is at the same time, and so I'm not going to go into any of that until later on in a couple of weeks. But let's talk about NHSN groups. So, other setup options, joining an NHSN group. Any entity can maintain a group within NHSN, a corporate chain, a QIO. So I will tell you that the QIO wants to have a group, and I will tell you that the CMS, or what we call it, the NCC, the National Coordinating Center, wants to have a group. You, within your own organization, may have 2 or 3 nursing homes as a corporate chain. You can set up a group of just those 2 or 3 nursing homes, 8 nursing homes, it doesn't matter. That you can have it within your own corporate chain to have a user group there too. What you need is the NHSN facility joins using a group ID number and a joining password that's provided by the group to the group. After joining, the facility will see the conferred right screen that shows which data the group wants the facility to share. The facility must then press the accept button on the conferred right screen to share the data. Each facility that joins the group does not have access to data from other facilities within the group. Only the facility administrator can see everybody's data.
Just to clarify, so in the nursing home world, they have a nursing home administrator.
Yes.
So I just want to clarify that when you're talking administrator, you're talking an administrator of the NHSN, not the administrator of the facility.
Correct. It is, yes. It could be the same person, but it may not be, because you may decide, you have to decide who your security administrator, facility administrator in NHSN is. It can be the administrator at your facility, but I'm not sure that's really who it would be. It probably is going to be your infection preventionist. And again, you may have a small facility and that administrator wants it. But if the administrator is the administrator for multiple facilities, that may be the facility administrator for the group.
Okay. And there's one other question in the chat. So the question is, if I leave a building and go to another building, do I have to start over, or is my SAMS card good no matter where I go? Do I have to surrender my card to my facility?
I do not believe so. That is why there's the deactivation piece. You are deactivated from that facility, but then you would get reactivated as a user in the new facility. The grill card usually follows you throughout because you've already gone through that process of identifying proofing. And then you need to be a user within the next facility. But I am going to double check on that because I am not 100% sure about it. I know that I can use my SAMS card to get into multiple sites here at Health Centric, but I have access to all of those. So I don't 100% know that. My thought process is saying that the SAMS card is good wherever. You just have to have user rights within a facility to use the same SAMS card. But we'll check on it. Are you writing that down for me?
I did.
Okay. We will definitely check on it, and when you call next week, we hopefully will have an answer to that. So let's go into how you do a group, because this is a little bit confusing for people. Becoming part of a group can allow you to receive NHSN assistance from people at your QIO, at the QIN rather, which is formerly the QIO. It can give the Department of Health in your state access to help troubleshoot your NHSN data and answer questions and errors. It allows a facility to share data with corporate management and or the infection preventionist colleagues. I know that for some hospitals, they have a system for like their multiple hospital systems. They have individual infection preventionists in the hospital, but they also have a system-wide infection preventionist, and she's set up a group that I know of within the 3 hospitals that I'm speaking of. It allows the facility to share data within an infection prevention or a quality collaborative. and it allows the facility to receive consultation from experienced users in other states, or even anyone, when you're in a group, any user of that group can get help out, because I'll tell you, I go into NHSN and I think I learn something new every day I go in there. Yep.
So Reggie, one of our associates, provided the answer to that.
Oh, she has it. Perfect.
And Reggie says that your SAM's account goes with you. It is up to the facility to pull you off the account.
So, and then up to the new facility to put you in as a user. That's how I would read that. Okay, I guess we answered the question. Thanks, Reg. So, to join a group. This is a grid that tells you about all the groups for this particular group of you in the New England region. It's a little confusing because we have two separate, well, actually we have 4 groups that you could join into. For the New England, for the Maine, Massachusetts, and Rhode Island people, you're going to join the QIN-QIO and the NCC-CMS group. For the Connecticut, New Hampshire, and Vermont group, you're going to join the New England, spelled out, QIN-QIO group, and the NCC-CMS group. For Massachusetts only, you're going to also confer rights to your Mass DTH. So just remember, these are the ID group numbers. In the third column are the group joining passwords. I would say print this. No, I'm not going to tell you to print this. What's going to happen is tomorrow, your leads are going to receive grids that are only for your state specific, so that you won't see all of these other ones that you don't need on your grid. And so be on the lookout from your state leaders. Janet was not able to be here today, but she will email those out to all the state leads, and they then in turn will mail them out to all of their nursing homes tomorrow, so that you will be able to see exactly who you in Maine, who you should report, who you should confer rights to, Massachusetts and Rhode Island, and then Connecticut, New Hampshire, and Vermont. So what does it look like? You go back to your membership page, and you click on, you go back to your landing page, actually, and you will click on the navigation bar, groups. That then will expand, and you're going to click on join. You're going to then enter the ID and password for this facility to join the group that we want you to join. So if you go back, we want all of you to join the NCC, the third one down in the row, in the column here, the first column, NCC-CMS, and that's 38648 with this DMAIC, and this is all of the New England nursing homes have to sign on to that. So what you would do is in the group ID, the first box, you would put the 38648 in the first box, and then in the group joining password, you would put DMAIC, capital letters. Once those are in there, you click join group. And that will then bring you to what is called the conferred rights template. And if you look on the middle box, please review the data rights for Region 3 New Hampshire QIO. What it will say in there is this. It will look like this. Well, I did the ones for the Rhode Island. I should have probably done the NCC one. You'll get this defining rights box that in here will say, instead of facilities joining the New England QIO long-term care, it will say the NCC, and that is what you have to join. The only thing you have to do at this point, and this is what the Connecticut one will look like. I should have done one for the NCC. I apologize for that. What you have to do is, let's go back, is go to the bottom of that screen and click accept. That will then mean that you have now accepted these groups, and that now these groups can see your data. And this is how they're going to be able to track and trend and look at how we do in our progress in this task. So, I guess we have now completed how to set up a facility, how to get the groups in there, and to be able to be now ready to enter data. If you have any questions, there is the NHSN online help manual. You can click right here where the arrow is and get that, or as always, NHSN@cdc.gov. You can ask questions there as well. And that's what I want to remind you. Email is your only way to communicate with NHSN. So please also save this. This is an important email to have saved in your computer, NHSN@cdc.gov. With any changes in your email address, please let them know that, and if you have any questions. So let's do a summary. You now know how to add the NHSN website to your favorites. You have an idea of how to use the NHSN Navigation. You've learned today how to map long-term care facility locations. You know how to create a monthly reporting plan. You know how to add users and assign user rights, and you know how to join, or you've heard how to join groups. You know that this is your Bible, and we now have completed most of page 2, except for the very bottom of reporting into NHSN, and like we said, we will do that at a later date. This is the times that we are now going to have open calls from September 28th through October 26th. It's every Wednesday at this time, 11 to noon. It's just going to be an audio. I don't believe right now there's going to be any web unless we do feel that in the reporting of data we need to have some type of a website, and we will. So, I think we can now open up the lines. Oh, okay.
So there's a question from Melissa DeMeglio in chat. Can a user who is given all rights add or edit other users, or is that only possible for the administrator, the NHSN administrator?
I believe if you have been given if the administrator checks off administrator, you do have the right. You only have the rights if you're the administrator.
So what does all rights mean?
I think it means everything else except the administrative right of adding and actually, now that I think of it, you may be able to get all the rights too. I just am not. You may not be considered the contact person, because the facility administrator is usually who is the contact person with NHSN. I would have to play around with that, and I've never had to worry about that because I've always been an administrator. Maybe my Reggie out there can tell me if I unmute the line. What is it? So, to unmute the line and ask a question, you press #6. And anyone in the audience can ask that question. And Reggie, if you're there, maybe you know the answer to this. If not, we'll put it down and I will double check that all rights does ultimately give everybody the ability to add and delete users.
So then the next part of that question that Melissa has is, so can we have more than one administrator?
NHSN is going to tell you no, you should only have one administrator. So, I do know places have 2 administrators.
Okay. We have another question in the chat. Can you go back to the slide with student talk information, 928 to 10:6, for the contact and the code?
This here? The weekly phone call?
Weekly phone call.
Oh, sure. This one here?
So this is the slide. Yeah, so this is a weekly open office call, so you can call in and ask your questions or get some support without having any scheduled time or playing any phone tag with anybody. You'll get your questions answered right on the line.
Again, if you have a question, you can ask it on the phone, and press #6 to ask your question.
There's another question in the chat that says, will the presentation be emailed to the participants?
You emailed the slides already to the participants, but the recording
Will be available on our website.
Will be available on our website.
The slides were emailed out yesterday morning. The presentation recording, slides, transcripts, any important contact information for NHSN, SAMS, our state leads will all be available on our website. That link has been included in all the email invites. A thank you email will be sent out tomorrow with the evaluation and URL website link to find all of these materials.
Any more questions?
So Reggie did respond that there is only one administrator, but there can be several other types of users. I don't know, Reggie, if that implies that the other types of users have the ability to add or edit users, or is that only the responsibility of the NHSN administrator?
We know that it is the responsibility of the NHSN administrator. I don't know that if you have all rights, if you also can get in to add and delete a user. We will double check with NHSN on that for sure.
Thank you. Okay, I'm just checking in the chat.
Again, if you have questions, please know to unmute your lines. You press #6 so you can ask a question. Don't be afraid, we won't bite you, and no question is stupid, because trust me, you would not believe the questions that I ask, because I don't even know all of the answers, as you can see. It's a very complicated system, and we appreciate you offering up your time to do this. So please ask any question you like.
I'd like to just point out a comment from Cynthia Hale in the chat. Cynthia has reminded everybody that their SAMS card is very important. It's got personal information tied to it, so treat it with a lot of security.
Right. So I treat it like a credit card. I leave it in my wallet because it does allow you, as long as you're using Internet Explorer, to get into NHSN, your NHSN, even at home if your computer will allow you to do that. So I do treat it as a credit card. So, again, is that a question? Do I hear one?
Hi, Maureen.
Hi.
Is there a deadline for enrollment? Because on the checklist, there's no enrollment deadline. Can you clarify that, please?
There is an enrollment. I believe everyone is supposed. Do you know the exact dates of the enrollment time? Janet's not here today. I want to say that everyone is supposed to be enrolled by the end of October, and that the next deliverable will be that everyone has data in NHSN by November 25th. Does that answer the question? That's why there's such a push to get everybody to do this, because it doesn't happen in 2 minutes. I think that you had a September deadline, and NHSN pushed it out to another month, to October.
Right. So we were recruiting for the CDI work
Okay.
through the end of August. CMS has allowed more time for that. At this moment, all October data should be entered into the NHSN by November 25th. So if by the middle of October you're still having trouble, we do hope that you've reached out to your state contact person.
Does that help?
Yes, thank you.
Okay. Any more questions?
Maureen, so we're having a little bit of technical difficulty. I don't know if anyone else is, as far as being able to see the chat. The chat has disappeared on my screen, so if you are putting a question in the chat, please press #6 and ask your question.
There are no questions currently.
Thank you, Florence.
Oh, that was Florence? Oh.
Hi, this is Reggie.
Hey, Reg.
Hi. So since y'all can't see the chat, I had responded that only administrators can edit or add the users, but users have capabilities that that kind of they can add and edit some data and enter data, but only the administrator can do the overall adding and editing of users and looking at the data and entering data and so forth. It's kind of a be-all, end-all role, and there's only one administrator. So I hope that answers all the questions in the chat.
And so basically when an administrator is going to leave, they should go in and then designate administrative rights on that page. I'll go back to that page so you can see where you can click off. You can see the rights. So if I was, this particular person is Q-worthy. If it was Maureen Marsella, I'm the administrator. I added this new person, but now I'm leaving. I can then go in and click off administrator for this person, and then they will be the administrator, so they will then have the rights. And then I guess they then would go in and deactivate myself because I'm leaving. Does that sound right?
Correct. Correct. Can you hear me okay?
Yes.
Okay, thank you. So, yes, we had a facility, to use an example, the administrator was leaving and had notified us via email, so we had to actually say to the person, okay, in the interim, you can take one of your SANS users as a temporary administrator until you have a new DNS come in who's going to take that role, or whoever is going to be your administrator. So there are directions, and I can send that along to you, Maureen, so that you can share it.
And where are those directions? Are they in the guide, the facility administrator guide?
No, it's in a different document that I will send to you. It kind of went out a month ago. It's under the hemovigilance for long-term care. It's kind of embedded in this very unusual place in a document.
Okay, we'll take that and we will send that out to all of you. That would be great. I have another question, and I think I know the answer, and I do know how to answer this one. Do I have to make a monthly reporting plan for each of my locations? Or does my one reporting plan apply to all? Your one reporting plan for the month applies to all. So all you have to do is a monthly reporting plan for the month, the facility. That's where, remember where I went through fact-wide? It does pick all that up for you. See over here, when you click over here on the CDI, which we can't see right now, you would click that, and then all you have to do is copy that for another month. The CDI will go through for the whole facility of all the locations that you have put into NHSN. So so you can cut us short now, but we can save all these questions for next week because we will have the open calling hours next week. I'd like to thank you for this great discussion. It was terrific. And just a few more announcements. When we close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out. We greatly appreciate it, and it does give us an idea of how successful our presentations are. If you don't have time to fill it out today, you will receive an email tomorrow morning with the link to the evaluation as well as a link to the event page on our website. Today's presentation will be posted on the website, like we told you, within a few days, and the recording and the transcript will be added there. In closing, a last reminder. Here is a slide with all our state contacts that are available to you as a one-on-one basis, and feel free to call them. If they're not available, you also can call me. I'm Marsella at healthcentricadvisors.org as well. Feel free. Or you can call me at 401-528-3223. and I will be more than willing to help you walk through this process because we understand it is not an easy process. Again, thank you so much for attending today, and we'll talk to you next Wednesday at 11.